Can you envision some of the difficult choices we may be forced to make about care, and what strain will it place on the practice of medicine?
The challenges of a busy influenza season are great, and we are working actively with the medical community, the healthcare system, as well as the private sector to anticipate the kind of challenges that will be out there and to be ready for them. We are trying to develop better tools for providers and for the public to know when they need to see the doctor or nurse and when they don't, so that we can relieve some of the pressure on the outpatient offices and avoid those long lines in the emergency department. For instance, we have testing recommendations that we really don't need to get a test for everyone. The testing for influenza this year really ought to be focused on hospitalized patients. We're also working with training to make sure that we have intensive care unit capacity and people who know how to work with ventilators and so forth. So there are a lot of challenges on the healthcare system, both the outpatient and inpatient part of it, some of which we can address with training and with coordination.
What about choices, or who gets care and who doesn't?
Yeah. You know, at this point, what we're trying to do is use the best scientific evidence to understand what kind of care makes the most sense in different circumstances. We also have learned a lot from the Southern Hemisphere about what to expect, and they didn't really have to make those difficult choices of who gets a ventilator and who didn't. They were able to make it through in terms of their intensive care unit capacity. But we know that there are some communities that are vulnerable, and that's why we have some of the federal assets available for particular special needs. So at this point, we're really trying to use the science of what is going on to make clinical recommendations of who should get what kind of treatment. And so we're not really looking at a rationing kind of
So let's
situation.
talk about resources.
Sure.
Given the existing shortage of physicians, what strategy is the agency employing to improve the capacity of the physician community to provide care during a pandemic? What does this say about this nation's need to address its shortage of physicians as part of healthcare reform?
Yeah. You know, scarce resources in terms of providers is a huge problem in many of our communities. For a pandemic, we really can't expect to have enough assets everywhere in terms of, you know, a hurricane, for instance, we can send people from one part of the country to another part of the country, but with a pandemic, everyone may be affected. We're taking some steps to try to broaden the provider community, trying to enroll the Medical Reserve Corps as something that we can tap into, for instance, and also understanding when healthcare professional is needed or when home care is enough. So I think that this pandemic hasn't come at a good time in terms of our healthcare system's capacity, and what we're trying to do is get as much support ready for the fall as possible.
Do you have a sense as to where are the most vulnerable communities?
There's been an effort to work with states and cities to understand their gaps. They have been submitting reports to us at CDC and at HHS about their readiness, both their health sector readiness and their public health readiness. And at this point, I think it's fair to say that everyone is going to have a challenge this fall with managing the kind of health care challenges we expect, as well as a large vaccination program. What we're trying to do is work across the board with everyone to share best practices and to get resources out to the states and cities, because we know they can't really handle this without those extra resources.
Thank you. Dr. Blank, developing general preparedness guidance seems key to survival of any small business operation during a pandemic. But unlike large firms, the resources of small businesses are much more limited. How do you expect a small business to prepare for a pandemic without placing serious financial strain on itself, particularly in today's financial climate?
It's a very important question, and of course the answer has to be particular to the specific small business and will vary depending upon what area one's business is in. Cross-training of employees, which small businesses do naturally because more employees often cover more functions. Businesses might want to expand that to really think about what would happen if one or two key employees were out and who would take over and how they could use remaining employees. telecommuting in some places where you're not doing customer service may be more possible. They may want to coordinate and communicate with other small businesses in the area so that, say, if you're a small healthcare practice, that you could actually work jointly to cover your patients in a way that you wouldn't in normal times.
I hear you, and I know that is the right proactive way to plan for a pandemic, but given the constraint and financial challenges that small businesses are going through, it's quite difficult for them to think proactively.
I agree with that, and I think it's one reason why we all here are trying to get the word out to both large and small businesses about the need to do some advanced planning, because if this comes, it could come quite quickly to your local area. And if you haven't thought about it ahead of time, you'll be in worse shape. But as you pointed out in your opening statement, small businesses will be more negatively impacted by this because they just don't have the same degree of flexibility.
Mr. Mago, in light of the recent avian flu scare a few years ago, significant strides have been made to prepare for businesses for H1N1 emergency. But what kind of support should small businesses expect from state and local governments during a pandemic, and who will coordinate those efforts?
Thank you. It's a great question. One of the things that we've been really relying on is the fact that this is a true partnership between the intergovernmental actors at the federal, the state, and the local level. We're also recognizing that, as you saw in the spring, the H1N1 presented itself around the country in different ways at different times in different places. And so what that resulted in is an effort to make sure that each of those areas had the right information and that they were interacting with their local health officials to make informed decisions based on the impact that they were seeing locally. What we were trying to do and continue to do is inform the decision makers, and our Intergovernmental Affairs Office, for instance, works with all the state Homeland Security advisors and emergency managers to make sure that they're informed during the case on information that we have. And so we work through our intergovernmental processes at DHS. We also, but the key here is that the same information is available from any actor. So you're going to hear the message from the Intergovernmental Affairs Office to the Homeland Security advisors. You're going to hear it from my office working with our infrastructure protection community and making sure the business community is hearing that. And then you're hearing the same information and guidance coming to coordinate from the CDC and the health community. So I think what you saw in the planning for 06, 07 what it's benefited is we're actually all listening to each other and working in a more collaborative manner to make sure that everyone has the information they need to make more informed decisions.
Well, I am concerned about the fact that the General Accountability Office report, they heard from the private sector the fact that it is unclear for small businesses and businesses about the respective role and responsibility of the federal and state governments. So during a pandemic emergency. And my question is, do you feel that there is a coordinated effort between state and federal governments in working together for a strategy in terms of preparedness?
From the Department of Homeland Security side, and then maybe from the public health side, I would say very much so we're coordinating in the governmental level. The shared responsibility model approach that we've taken is to make sure that state actors have what we know when we know it. So we're trying to be very open and transparent with the information that we have based on the science, but then using the updated guidance and just making sure that people are kept abreast. And my office, we send out a weekly email front-loading it with any updates that we necessarily have. And that data...
I hear you when you talk about providing information. Yeah. My question is coordination. So if any of the other.
Sure.
Yeah, I think that the public really expects appropriately that we have a seamless coordination at the public health level between cities, counties, states, and the federal level. And very much a part of our planning process this summer, as we are readying the country for increase in influenza, has been this city, county, state, federal partnership. So our vaccine task force that's trying to figure out how we're going to implement this large-scale voluntary vaccination program has a steering committee composed of people from several different levels of public health government. And so from the strategy to the planning to the evaluation and feedback, we're really trying to work seamlessly. I think that most of what happens with influenza happens at the local level. And if we don't have strong local implementers, we will fail. And so we are trying to incorporate that local perspective and the state leadership into the federal planning at every step.
Thank you. Mr. Thompson.